Welcome back. You may have missed this, but recently it was Tardive Dyskinesia Week, and we talked all about this with a couple of experts who focused on uncontrollable movements, what you can do to help this problem, recent research, and much more. Let's take a look.
May is Mental Health Awareness Month, a time to increase awareness and support for those impacted by mental health conditions. It's also important to note that some people living with a mental health condition may also experience tardive dyskinesia, or TD, a chronic condition characterized by uncontrollable body movements that can occur in one or more areas in the body. TD is associated with taking certain mental health medicines like antipsychotics to treat conditions like depression, bipolar disorder, schizoaffective disorder, or anxiety disorder. Joining us today to bring more awareness to TD and explain the symptoms and impact is Dr. Rakesh Jain, Clinical Professor, Department of Psychiatry at Texas Tech University School of Medicine in Austin, Texas. Dr. Jain, thanks for joining us.
It is my pleasure, so that we can talk about this very important issue.
It is very important, and I would love for you to explain the issues surrounding mental health, especially when it comes to medication.
Absolutely, Christine. The fact of the matter is mental health is our favorite possession, our most important possession, but some of us aren't so lucky to have perfect mental health, and many times we do seek the benefits of medications. And as you said very accurately, tardive dyskinesia can be associated with certain medications like antipsychotics we take for a variety of psychiatric disorders. It's really important to know the symptoms of it. You're right. We got to know the symptoms before we can take it forward. And the symptoms are parts of the body. And remember, tardive dyskinesia can start in one or more parts of the body, but generally speaking, starts in the face and the mouth. It can be this, excess blinking. It can be puckering or grimacing. It can be clenching of the teeth. It can be tongue moving around too much. It can be your fingers moving around, making it difficult to type or tie your shoelaces or to cook. All of that can happen. And it can happen in different severities. Some people have it kind of mild, kind of moderate. Some people sadly have it very severe. I want to have you and our viewers remember this. Common disorder. 600,000 Americans have this condition, and only 25%, 1 out of 4 of the 600,000 have the diagnosis. 3 out of 4 are still out there. And I'm hoping if they're listening to us and watching us and they recognize it, that they would go to a website called talkabouttd.com and get better educated about it.
What else do we need to know about tardive dyskinesia and the symptoms?
We do need to know quite a bit more, and that's why I'm so grateful for the sponsorship of Neurocrine Biosciences and allowing for this conversation to happen. The symptoms are physical, like I just showed you in my hands and my face, my tongue, but the real plight, the other symptoms, are psychological. These folks often already have a great deal of difficulty with depression and anxiety and low self-esteem and low self-confidence, and tardive can really crash it. It can dramatically worsen it. These folks often have challenges with social interactions. They can be shy, they can be withdrawn, and tardive dyskinesia can just add to the burden of it. So think about tardive dyskinesia as a combination of movement difficulties with these physical, psychological, and social problems, and it can really reduce human life. And that's why talkabouttd.com is a great place to start the journey to recognizing it, finding the right healthcare provider in case you don't have it, and take it to the next step, accurate identification and appropriate treatment.
And any other key takeaways that you'd like our audience to remember today about TD and mental health overall?
Christine, I appreciate that question because mental health is the key to a successful life. No matter where you are, you're in Salt Lake City, I'm in Texas, it doesn't matter. It's a number one possession. Point number 2 to remember, if tardive dyskinesia has arrived in your or a loved one's life, it is a frightening experience. Don't go on this journey by yourself. Pull your healthcare provider in, and then finally, go to talkabouttd.com, get to know the disorder, get it identified, get it treated. And I thank you so much for the opportunity to be able to discuss this very important topic with you.
Well, thank you so much, Dr. Jain, for joining us today. Really appreciate this essential information, especially during Mental Health Awareness Month about TD and more. Thanks for your time.
Thank you.